Hello, my name is Nicole Kaipa.
Hi, my name is Najibe Sainz.
Hi, my name is Gabriela Leighton. The dementia that our group is going to talk is frontotemporal dementia semantic variant. The etiology about this dementia is semantic dementia occurs following localized brain degeneration in temporal lobes, especially the dominant one. It is recognized when the aphasia is fluent and there is a selective and progressive impairment of semantics memory. The degree of impairment in a semantic memory correlates significantly with the extent of cortical atrophy in the left anterior temporal lobe, but not with atrophy in the adjacent ventromedial frontal cortex.
Areas of the brain affected. Frontotemporal dementia is a general term for a group of brain disorders that primarily affect the frontal and temporal lobes of the brain. These areas of the brain are usually associated with personality, behavior, and language. Symptoms. The signs and symptoms of frontotemporal dementia can be different for each person. Symptoms get progressively worse over time, usually over years. Clusters of symptom types tend to occur together, and it is possible to have more than one cluster of symptom types. The most common things of frontotemporal dementia involve extreme change in behavior and personality. These include increasingly inappropriate social behavior, loss of empathy, and other interpersonal skills, such as being sensitive to other feelings, lack of judgment, lack of interest, apathy, which may be mistaken for depression, repetitive compulsive behavior, such as hiding, clapping, or smacking lips, a decline in personal hygiene, change in eating habits, usually overeating of having a preference for sweets and carbohydrates, eating in inedible objects, compulsive desire to put things in the mouth.
Okay, the course of the disease, semantic dementia, is the manifestation of a frontotemporal degeneration in which loss of primary functions, such as language, is observed, which progressively decreases, manifesting severe anomalies, deterioration of speech, writing, and comprehension of simple words, oral and writing. However, the fluid language does not show articulation or prosodic disorders, syntax and phonology preservation, and reading out loud can be dementia. In this type dementia, there's a selective disorder of the semantic memory. So there is a loss of semantic representation of objects. When the disease has progressed, the following are observed: difficulties in recognizing familiar faces and voices. It is important to rule out other degenerative diseases such as Alzheimer's disease and primary progressive aphasia.
The pharmacological and non-pharmacological treatment, there is currently no cure or specific treatment for frontotemporal dementia. Medications used to treat or delay Alzheimer's disease do not seem to work for people with frontotemporal dementia, and some may worsen the symptoms of the condition, but certain medications can help control symptoms. 1. Antidepressants. Some types of antidepressants, such as trazodone, may reduce the behavioral problems associated with frontotemporal dementia. Selective serotonin reuptake inhibitors, such as citalopram, paroxetine, or sertraline, were also effective in some people. 2. Antipsychotics. Medications such as olanzapine or quetiapine are sometimes used to treat the behavioral problems of, of frontotemporal dementia. However, these drugs should be used with caution in people with dementia because of the risk of serious side effects, including an increased risk of death. 3. On the non-pharmacological side, people with language difficulties can take advantage of speech therapy to learn alternative strategies to communicate.
Now about the cognitive simulation. An intervention is designed through individual cognitive stimulation workshops aimed at the patients who are already diagnosed. In order to be able to carry out the intervention, it is very important to carry out an initial assessment in which we can know the cognitive profile of the patient. This assessment will also be carried out at the end of the intervention to check if any changes have occurred. The program is made up of 12 sessions, lasting about 40 minutes. Three types of sessions are proposed, differentiated by their objectives and the cognitive and linguistic functions that are worked on these typologies. On these typologies will be alternated in the intervention sessions. And these are the references, and that's all. Thank you so much.